Please focus on saving lives.
If COVID doesn't get you, nuke or would.
We cannot say that we have peaked.
So I want to go across to Afroz first to tell us his story, what happened with his mom.
September end, my mother had got corona, she got cured, she was at home, everything went well for 3-4 months, and suddenly in April she started complaining that she had like a slight pain over her, on the head and a slight nose blockage. I immediately took her to an ENT surgeon who she regularly goes to. The doctor ENT surgeon checked up and he said there's nothing, there's a little lack of oil in the eye, and the usual stuff was given. In fact, a medicine was prescribed for cold, which she took for 7-8 days, and the morning when I rushed her to the hospital, her eye almost popped out. And she was in terrible pain. She was absolutely fine in the night. She went through MRI within 2 hours of pain, and then they gave me the terrible news when the doctor tells you that your mother's left eye will be knocked out.
How frequently are you picking up these cases? Why do you think this is happening?
The phenomenon started sometime in late December or early January when we were seeing a couple of cases a month, and we were like, okay, this itself is a little high for regular, mucormycosis. So by March, we had sort of gotten a sense of what is happening. It's easy to blame, steroids and say it's only because of steroids. You speak to any physician who's been treating COVID patients, and they'll tell you that nothing else except steroids work when the patient is coming in breathless. And we know that one of the side effects of these steroids is that it pushes up your blood sugar level. If COVID doesn't get you, nuke or would.
Because of the COVID and the diabetes or the steroid usage or the extra oxygen which we are giving, our immunity is coming down, which is entering inside through the paranasal sinuses, and this connects to the eye. Once the eye gets infected, the eyes are connected to the brain because eyes are actually part of the brain. And that's when the infection spreads. The problem which we need to be careful is that don't give the steroid just simply.
We need to get the message across to everybody that after the discharge, we need to keep a regular follow-up, and along with monitoring our temperature and the oxygen saturation that we are all well aware of, we should also monitor our blood sugar levels. A lot of these cases are largely preventable if we focus on good sugar control.
Has India peaked, or are we under-reporting, or dare I say under-testing? Has the lockdown worked or not?
Of course, the reported cases are a function of testing, we know. And I do not believe the absolute numbers at all, as you said, that they are underreported. But I do believe that you can still observe some of the relative trend, and that astronomical super surge that we saw, that is indeed slowing down.
So how are we to see this? The glass half full or half empty? Have we really peaked or not?
Because we registered 414,000 cases on a day, 350,000, 320,000, 300,000 seems smaller to us on a relative scale. But this is larger than any country in the world has ever reported on a day. So we still have to remember that we are in a precarious situation and in a very deep crisis.
The current situation reflects that we were going upward and then now we are moving downward. But we also know that there are a number of states, especially in southern part of the country, which are still showing some upward trend. So for a country of the size of India, we cannot say that we have peaked, and it has a limited meaning. The truth is, throughout the pandemic, across the world, that the number of cases which have been reported are 1/6, 1/8, 1/10 of the estimated cases. In case of India, we know through Zero survey that actual estimated cases are 20-fold of what is being reported. And as the number of officially reported cases goes down and the testing remains similar, we can say that as a multiplication factor decline. So we cannot be very confident that those are declining. As Professor Mukherjee was also saying that when we are reporting 400,000 cases, then coming down to 380,000, 360,000 does not make much of the difference, while we know the actual number is manifold of this.
Congress says the toolkit is fake. It's not Congress party toolkit. It calls it diversionary tactics.
And while we are all going through challenging times, and deaths can never be about statistics, but I have to say this with a heavy heart, that non-BJP ruled states, you know what is the average COVID deaths per million? 277. and that figure for BJP governed states is 133 per million. So if the Congress is talking about diversionary tactics, let me tell you, Maharashtra accounts for over 30% of the total deaths in India, over 22% of the total infections, and over 14% of the active caseload.
I urge the Prime Minister and his ecosystem, please do not waste your time on propagating petty falsehood. Please focus on saving lives. Thousands of dead bodies have been found floating in the Ganga and the Yamuna. Is that a lie? Thousands of cremations and burials have taken place on the banks of these rivers. Is it a lie? India today has eloquently and extensively captured the state of our healthcare infrastructure. Is that a lie? Citizens were gasping for oxygen. Is that a lie? There was an acute shortage of oxygen beds. Is that a lie? There was an acute shortage, and currently an acute shortage exists of vaccines. Is this a lie?
Okay.
Is it a lie that there is a shortage of antiviral drugs?
If this toolkit was true, and it says that the Kumbh was more of an assertion of power and Eid was just a happy festival, it's an attempt to create public disorder and communal discord. And that is why any such attempt, which is sinister in character, needs to be taken to a police for investigation and a court of law for adjudication. It does not need a press conference. If a political party has been consigned to the bins of electoral defeat, the ruling party with 303 seats should not really bother about them. At this point, to say that there are no oxygen beds, I will only say one thing: 17,000 ventilators since 1947 in India till last year in 2020 is a telling statement on how every government in this country has performed when it comes to healthcare. Will the Congress call it a Xi Jinping pandemic? Will it call it a Chinese pandemic? As Rahul Gandhi has tweeted on the 8th of May, Movid pandemic. We know what the insinuation is. M-O-V-I-D.
Sure.